Extension is really focusing their efforts on how does the community need to change in order to make these healthier choices the easier choices. So we're working with local grocers and other initiatives in town to really focus on what changes do we need to make in this local community to promote health.
The U.S. Department of Agriculture's National Institute of Food and Agriculture awarded 2 K-State Research and Extension specialists more than $300,000 to recruit volunteers with diverse backgrounds and equip them with the necessary skills to create positive health-related changes through grassroots efforts in their communities. The grant will allow Elaine, Johannes, and Erin Yelland to implement a Master Health Volunteer program in Ottawa, Saline, Dickinson, Marion, McPherson, Cherokee, and Cowley counties. On today's Sound Living, efforts to improve the health of Kansans. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. According to Yelland, addressing the declining health of the American population is a pressing issue that requires innovative initiatives to produce significant impacts, and this grant is providing the support to recruit volunteers to improve individual, family, and community health. Yelland also thinks that the Master Health Volunteer Program initiative is a good fit with Extension's Culture of Health initiative.
K-State Research and Extension is really focusing on health, and that is identified as one of our 5 grand challenges. And currently, we're going through a big initiative to help improve community health across Kansas through K-State Research and Extension's Culture of Health campaign initiative. So we're really excited about this upcoming grant that's going to initiate some volunteer systems throughout select Kansas communities to help improve community health in those areas.
We're starting with 7 counties, and 5 of those counties are kind of clustered together, and the other 2 will be standalones?
Yes, USDA has funded K-State Research and Extension to pilot this initiative in 7 counties. 5 of the counties are clustered within central Kansas, and then 2 other counties, Cherokee County and Cowley County, are located down in southeast Kansas where we have some of the worst health disparities in the state. And through this initiative, we are going to train volunteers to understand principles of community leadership and community facilitation and understanding those unique health issues that are affecting your area. Then they're going to be able to go out and decide what are the major issues in my community and how can I make a difference. Perhaps they're going to put on some educational programs. Maybe they're going to help their local extension agent with some initiatives that they're already involved in. Or maybe they're going to go out and start their own coalition and bring all those key stakeholders that are dedicated to health in the community together to have a really needed conversation about how we can improve health. One of the key things that Extension always knows is that health or any issue really doesn't occur in a vacuum, and it can't be addressed by just one entity or organization. So it is so important that we're always talking about collaboration, whether that's with public health in the local public health department, or if it's with another local nonprofit, or all of them together. We oftentimes collaborate with the police department and fire department in local communities to really understand what issues they might be facing and what they're seeing as issues in the community. So bringing all of those key stakeholders together to address community health is key. So Extension isn't going to be doing it alone, but we're going to go out and train volunteers through this grant initiative to really understand what are the principles of community leadership and who do I need to be working with to really make a positive difference in our community?
Your expertise lies in adult development and aging. What are some key aspects that you'll want to focus in on that may translate to these communities?
I am very passionate about older adults, but one thing that we all have to realize is that we can't have healthy older adults if we're not being healthy across our lifespan. So through this grant initiative, we're hoping that we can train individuals to really be aware that in order to have healthy older adults and have communities that promote aging and promote healthy lifestyles, we really need to be considering health across the lifespan. So from the moment that you're born, those choices that your parent makes for you, and then as you get older, the choices that you're making for yourself are always going to impact the health that you are going to experience when you're an older adult. We have really high chronic disease rates across the United States, and we're seeing this happen more and more in young children. So my concern as an aging specialist is that these young kids who are being diagnosed with chronic diseases at an early age are not going to have near the opportunity to live a healthy lifestyle and maybe even live to their 60s, 70s, 80s, 90s like children who do not have these chronic diseases. So it's very important that we're looking at this from a lifespan perspective and understanding how we can make a difference across the lifespan in order to promote healthy communities and healthy individuals and healthy families.
One of the things we hear a lot about is type 2 diabetes and the fact that it is starting at a much younger age, and that's one of those things that can be controlled.
Exactly. So type 2 diabetes is really a human-controlled condition. It is not something that you're born with, and it's really something that can occur because of the choices that you're making in your lifestyle, whether that's diet or exercise, or even just going to the doctor and getting those proper health checkups. So it's very important that our volunteers are equipped to understand that these are significant health issues in our communities and how they can make a difference. And if that's through healthy nutrition, education, or if it's through making sure that we're getting the junk food out of schools and out of the school vending machines and getting the sugary drinks and those sorts of things out of our school districts and out of our meeting rooms, those sorts of environmental changes is what is really going to make a difference.
From the community standpoint, I think everybody knows that there are health issues in their community and they often don't know how to address them and sometimes feel a little lost. Is that where Extension is going to have an opportunity to come in and provide them some of the steps, the necessary steps that must be taken in order to get from point A to point B to point C?
So Extension in the past has been known for their research-based and unbiased education and information, and that's not going to change. We're still going to be offering wonderful Extension programs where you can come and learn about a variety of different topics from us. But now Extension is really going to be focusing their efforts on something that we call policy, systems, and environmental change. So policy, systems, and environmental change really focuses on making the healthy choice the easy choice. That might be initiating a policy in a school that they are not to have junk food and foods with a certain amount of fat and sugar and those sorts of things in those school vending machines. Perhaps it is implementing a policy at a major employer in town that they are to serve healthy, nutritious options during workplace meetings rather than the traditional donuts and pop and coffee. So maybe it's making those small little changes that can really make a big difference. Something that the research shows is that having a direct education program with someone and just talking with them about it's important to eat healthy and you should be eating fruits and vegetables and whole grains and all those sorts of things can be wonderful. But if their environment is not supportive of that, if they don't have a local grocery store that is carrying whole foods and nutritious foods, then that's not going to be a viable option for them. So instead of just solely relying on education to make a difference, Extension is really focusing their efforts on how does the community need to change in order to make these healthier choices the easier choices. So we're working with local grocers and other initiatives in town to really focus on what changes do we need to make in this local community to promote health.
And sometimes it comes down to exercise as well. I know the nutrition part is important, but there's also that physical activity component as well.
So, of course, when we're talking about health and Extension, we often are talking about big health. So this includes more than physical activity and nutrition. We're also focusing on things like financial health, mental and emotional health, and even health and safety across the lifespan. But now through these initiatives, we're really hoping to talk with community leaders about how they can make their town more appropriate for physical activity. Is there a walking trail that needs to be developed? Is there a group of individuals in town who are passionate about that and can lead that effort? But beyond that, thinking about, are our streets and our sidewalks safe for people of all ages and abilities to go out and engage in exercise and go for a walk around the neighborhood? If our area is not safe and if we don't have a safe environment in which to exercise, that's really going to limit people from being able to engage in that type of activity. And so Extension is working to address those types of issues and have community conversations about it, and then go back and report to those key stakeholders about what we've learned.
A lot of things the communities will have to consider, and I guess that's really where Extension comes in, is going through this training, getting the conversation started, and then letting the communities decide what are their top 2, 3, 4, 5 priorities.
Absolutely. So Extension is not there to really decide on those priorities for you, but Extension can be a valuable player in having those conversations, gathering those key stakeholders together, and then facilitating that conversation. Many of our Extension professionals across the state are trained in community facilitation. So we are very excited about being that connection in the community to bring people together to have these conversations. And in fact, this March, our Extension professionals are going to be coming together with a couple of key stakeholders in their community to start some initial community conversations for health. We are calling these very critical conversations because it's going to help our Extension professionals identify 2 key stakeholders, bring them to the table, and talk about what is Extension's role in their local community and how can we harness the value of Extension to go forward and make the biggest difference possible in our communities.
You have an aggressive timeline for this project. You're going to look for volunteers and have those lined up by the summer and try to get them trained in the fall.
That is our timeline, and we're going to try to stick with it. Right now, we are really working on the curriculum development and figuring out exactly what we need to be training our volunteers on and how to best utilize their own diverse and unique skill sets and opportunities to make a difference in their community. And then Extension agents in those 7 communities will be reaching out and identifying volunteers and asking for volunteers to come forward and identify themselves to be involved in this effort. The unique thing about our Health Volunteer Initiative is that it's going to be a combination of in-person and online training. So you can come to the Extension office and learn face-to-face, but you're also going to spend time at home learning at your own pace, and you can do it on your own time. So there's not going to be a set time that you have to watch your videos. You can sit at home in your jammies at night and watch and learn from Extension professionals across the state. So we envision our volunteers being people of all ages, but particularly individuals who are passionate and dedicated to improving health. So perhaps you're a retired school nurse or a retired school nutritionist or a retired nurse in general. Perhaps you're a registered dietitian and you want to make more of a difference in your community. We're looking for people who are passionate about health and who are dedicated to making a difference in their community to be a part of this initiative.
And if people are in one of these 7 counties, they can contact their local Extension office and get all of the information as to where everything will be taking place and when it will be taking place.
Absolutely. So if you are interested in this initiative at all, reach out to your local Extension office. And even if this initiative is not going to be piloted in your county, perhaps there are other things that you can get involved in through your local Extension office. Extension is always looking for fun and exciting partners that's really going to broaden our efforts and help to spread the good message of K-State Research and Extension.
That's K-State Research and Extension Adult Development and Aging Specialist Erin Yelland. For information about the health-related programs being offered through Extension, contact the Extension office serving your county. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.